Confident Patient in a New World. I'm your co-host, Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. With me is my co-author and business partner at 2x2 Health, Wendy Benson. In the video series, we're talking with medical professionals from all specialties and sectors to explore the challenges which patients and their caregivers are facing now. The insights they share help us navigate the constant changes in healthcare we're seeing each day and help us gain confidence during the uncertain times. Joining us today is Dr. David Beyer from Quintessential Care Concierge Medicine. Dr. Beyer and Wendy, take it from here.
Thanks so much, Beth. And Dr. Beyer, welcome. We're so glad to have you join us.
Thank you. Thanks both of you for inviting me.
Absolutely. So just to start us off, Dr. Beyer, would you like to tell us just a little bit about your practice and the team that you work with?
So I'm in a concierge practice that is affiliated with Rush. We are off campus in the South Loop, very close to campus and very close to Rush's other building. And we've got, I work with both a registered nurse and as well as a nurse practitioner who will be starting just in a couple of weeks now.
Great. And we're talking with a number of nurses and nurse practitioners in this video series as well. So what a great way to have a comprehensive team. Thank you. So Dr. Beyer, when people hear the word concierge medicine, I think some people are just more familiar with that than others. How would you describe that model of care?
So concierge medicine can be referred to as boutique medicine or personalized care. I actually like the term personalized care the best because it's truly what it is. It's about knowing the patients and knowing their families and knowing not only about their health, but also about their social situations which greatly affect their health. Right. We see many families, which helps to really get to know people. Some of the time we'll make house calls, and I think those are the most incredible things from not only from the patient side, but from my side as a physician, because it really gives me a sense of who people are. You're welcomed into their home, and you get a full sense of them, not just what they may tell you in an office.
And I think that's why we work so well together, is because we like to be part of the family and get involved. And so that when we have conversations, I think that's been helpful that you know the family as well too. And you're not learning in the appointment, you kind of have a back history with them too.
Right. And so it's being able to take care of people and meet them where they're at. And I mean that in the psychological sense, even more than just the physical sense. So I find that's what it's about, and it's about access. If somebody has an issue, they don't want to necessarily talk to a medical assistant about it 3 times and then go back and forth. They can pick up the phone and talk to me directly, and we can figure things out.
And access has always been important in healthcare, but thinking about what we're going through now in light of recent times, it's just even more important because I just think that there's just an incredible amount of anxiety and uncertainty for all of us in lots of aspects of our lives. So in terms of this pandemic that we've been grappling with for several months now, what challenges and what problems have come up in the healthcare space and as it connects with your patients, and what are some modifications that have had to happen because of this?
Well, so first of all, it's the physical space, obviously. So whether you're seeing people face to face and in the office. So for a while we were not seeing anybody in the office as everything was closed down, and then we slowly come back. We're certainly very mindful of infection control. So patients are spread out. We're making every effort not to have people waiting in the waiting room. They come directly to the exam room, which honestly is the way I prefer it all the time. But there's that extra effort being done now with that. And there's also the time in between patients that it takes to sanitize the rooms as well. And that goes with the masks and social distancing, et cetera. So that's the physical aspect of things. We certainly do telephone visits and video visits as well, which as a concierge physician, we really were not doing video visits in the past, but wouldn't be uncommon for a patient to send me a picture of some issue and say, what do you think of this? And if it's something that I can rightfully tell over the phone or through the picture, they get the answer right there. Or I may say, as I did to somebody this morning, I saw that picture 2 days ago. It hasn't changed with what we did. Now you need to come in and see somebody. And so she will.
Yeah, I think it will be interesting to see what happens with the teleconferencing in healthcare now, because I agree. Of course, we want to see our patients in the office setting. And as a concierge physician, you go where they are, and sometimes it's a phone call or a picture on your phone. But when you have the 97-year-old lady in healthcare, that it's really hard for them to get to the appointment. It will be nice maybe in the future for them not to have to get a driver, for them to take them, and it's a couple hours out of their day, and it's really difficult. Hopefully that we can keep them at home and safe, and help them over the phone or video if they can figure it out.
And that's why family is so important, because family is certainly those technically challenged people are not going to be doing this on their own. But it's been very useful.
And for those that are dealing with complex medical conditions and have restrictions already going on with their environment, how have you coached your patients during this time that's even more challenging for them?
Well, so there's plenty of calls on a daily basis of, here's a scenario and what should we do? And my grandchild Johnny is going to daycare or going to go back to daycare, and can I see them? I am older, and all sorts of variations on that. So I think it's important to continue to have communication with your physician and be able to ask those questions. And you should ask those questions because every situation is slightly different and may very well have a slightly different answer to it. So not only for the COVID questions, but certainly as well for the non-COVID questions. And it's so important to not forget about our general health and our chronic conditions, whether it be heart failure, heart disease, high blood pressure, diabetes, emphysema, or anything else under the sun. We can't forget about that. And certainly the research is going to show and is showing that people who are putting off care are worse off for their overall health.
We're seeing that too. We're concerned, and we've been reading that there's a lot of research that suggests that people are delaying their care. And how do you communicate, what is really urgent and things that maybe can wait for a little bit when you're connecting with your patients and their family members? Like, how do you go about coaching them with questions like this?
I think it depends upon really the urgency of what the issue is. There certainly are people who are high risk who I've had to counsel and say, yes, you're high risk, but you've got, it may even be an infected tooth, and if you don't take care of that, then there's all sorts of other complications that you can come down with from that tooth itself, be it weight loss or systemic infection or all sorts of other issues. So issues like that still need to have in-person care. But then there's other issues, maybe coaching somebody about their diabetes and figuring out what is it that they can have access to in terms of eating, that it'd be a reasonable thing for them to eat during this time when maybe their access to food is different. And again, for anybody, there's the activity, which is so important. People who used to go out and walk and are afraid to now. So talking to them about what are the safe ways to go out and walk. I also have access with one of the trainers that I work with who's made some videos. And so we've got videos for them for various levels of training that people can do at the house.
And those are such concrete examples of ways that people can have some control over what's going on, right? Like, so if people have those, videos that they can watch and make sure that they have a grocery list where it's really helpful for them to know that there are things, safe routes, hopefully, to walk outside when they can, to be able to have something that's within their control, I think can be really, it's empowering, right? It makes us feel like we have something that we're able to do during this time that so many things are uncertain at this point. So I know we've talked a lot. Oh, were you about to say something, Dr. Byer?
Well, and so that, that of course speaks to the psychological aspect of all of this as well. Something I had not touched on, but there is plenty of psychological stress and anxiety through all of this. And that's something that needs to be managed as well. Absolutely.
I think when we're having conversations about our patients and their loved ones, there's such a need for a sense of community, whether it's our family, whether it's the family that we've chosen through our close friends and neighbors. When the caregivers reach out to you in terms of knowing how they can support their loved ones during this time, what advice do you have for the people that are supporting those that maybe are a little bit more vulnerable, especially during this time?
I think, again, it comes down to the same things we've been talking about, which is counseling on what are ways that they can not be stuck in the four walls or confines of their homes, and maybe it is just sitting out on the terrace for some people, just to get that sunshine in. Or I think early on in this, we talked a lot more about having routines, and so people who their routines, of course, everybody's routines were so dramatically impacted that coming up with a new routine is so important, so that people aren't just laying in bed and saying, gee, there's nothing to do, I can't get out. It's figuring out what kinds of things can people do at home or socially isolating, I should rephrase that, physically distancing, so that they can still manage their psychological perspective.
How much, in terms of the communications that you have with your patients, whether they're in person or whether they're on the telephone or video, how much has it really changed overall in the last several months?
So, in concierge medicine, there's always had a lot of phone calls. So, compared to a traditional practice where a doctor in traditional practice may be seeing 15, 20, 25 patients a day. Concierge medicine, people are not seeing that many a day. They're seeing much fewer than that. The rest of that time is mostly taken up with phone calls. There's paperwork for everybody, but a lot of it is really just being on the phone. So I would say that what's happened is there have been obviously fewer office visits or none during part of it. But the phone calls have certainly increased in volume. So, it may be, I may end up being on the phone from 8:30 in the morning until 4 in the afternoon, pretty much nonstop on certain days. It depends what comes out in the news and the day of the week, for that matter.
Right. Do you find yourself, and some of this we're talking about, we've already addressed, but do you find yourself sharing common themes with your patients over the last several months with what's going on? Are you getting a lot of similar questions, and are you sharing some of the same strategies, some of the same advice, and what are some of those common themes?
So the most common theme is certainly, what do I do? And when is this going to end? And how am I going to manage it? And so, the answer is nobody knows when it's going to end. It'll probably go on for a while. everybody needs to be wearing masks and washing their hands. And the more that we're all mindful of that, the more hopeful that we can be in terms of limiting spread and ending this sooner.
Yeah, I read an article a couple of months ago. Atul Gawande had one in the New Yorker, and it talked about how in the past when they've done studies on hand washing, and I know we've always talked about hand washing and how important it is, but how important or how the numbers drastically dropped if you washed it 5 times a day. I think the chance of the disease affecting you would drop by 40%, and if you did it 10 times a day, it would be even greater than that. So I think it's really important. I know we've always talked about it, especially during flu season, make sure you wash your hands. But I mean, it's so important. And it's been interesting to watch everyone now start washing their hands more, which is great. It's a shame we had to get to this to see that, but it will be interesting to see how that continues. Hopefully people don't get lazy and tired of washing their hands, and they have some good lotion so they don't get so itchy and chapped. Well, thank you, Dr. Beyer from Quintessential Care Concierge Medicine. If you'd like to connect with Dr. Beyer, visit www.davidrbeyermd.com or call him at 312-942-5100. Stay connected to us through our Facebook page as Wendy and I will continue our conversation with medical experts as we help the confident patient in the new world. Thank you, Dr. Beyer.
Thank you so much. We're so glad to have you. Thank you so much. And from all of us at 2x2 Health, we wish you great confidence and health. Thank you.